I did a review of what are the major issues across Africa that, again, are different from East and Central Europe and other places. And there's several. Besides farming, there's the fact that there are comorbidities, health conditions associated with tobacco in Africa that are not really important in the rest of the world. And let me just give you three. Tuberculosis. I don't have to tell anybody in this audience that TB is a major cause of death and disease on the continent, and that 60 to 70% of people with TB smoke. Yet virtually nowhere in the world is there an opportunity to treat TB and at the same time treat the underlying tobacco issues that most TB patients will have. Which means that when you send the TB patient out having treated their TB, they will go on to die of a tobacco-related cause of death. This is something uniquely important in an African setting. And I believe, as I'll get to it, that oral tobacco products offer a real solution to be alongside rifampicin and the other TB drugs for a number of reasons. The second condition, which is still a problem, particularly, again, in parts of Kenya, every country north of South Africa, is schistosomiasis, where we have known for decades that bladder cancer rates are substantially higher among the smoker than among the non-smoker exposed to schistosomiasis. And yet, I'm unaware of any substantial research or substantial effort made to think about how you intervene, and bladder cancer still remains an important factor in many of the parts of Africa where it becomes impossible to remove schisto from the rivers and streams and lakes where it is so common. The third area is the relationship between smoking and occupational exposure, particularly to mining and asbestos. We know that the combination of silica exposure and the combination of asbestos exposure and smoking multiplies the effect of tobacco both in the lung and in the rest of the body. And yet, very few studies and efforts are being made outside of South Africa in the 60s to really address this and to double down on finding ways to ensure that the mining population, those exposed to asbestos, are the ones that are preferentially given access to, in this case, oral tobacco products, so that they won't have the double exposure coming from the carcinogens of tobacco. I mention that because all of those are examples of issues that are off the global agenda. Nobody's particularly interested in them, yet they are particularly important in an African setting.